Specific ways to promote mental health. Mental health is an integral and essential component of health. The WHO Constitution states, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. An important implication of this definition is that mental health is more than just the absence of mental disorders or disabilities. Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. On this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern of individuals, communities, and societies throughout the world. Determinants of mental health. Multiple social, psychological, and biological factors determine the level of mental health of a person at any point of time. For example, violence and persistent socio-economic pressures are recognized risks to mental health. The clearest evidence is associated with sexual violence. Poor mental health is also associated with rapid social change, stressful work conditions, gender discrimination, social exclusion, unhealthy lifestyle, physical ill health, and human rights violations. There are specific psychological and personality factors that make people vulnerable to mental health problems. Biological risks include genetic factors. Mental health promotion and protection. Mental health promotion involves action that improve psychological well-being. This may involve creating an environment that supports mental health. An environment that respects and protects basic civil, political, socio-economic, and cultural rights is fundamental to mental health. Without the security and freedom provided by these rights, it is difficult to maintain a high level of mental health. National mental health policy should be concerned both with mental disorders and with broader issues that promote mental health. Mental health promotion should be mainstreamed into governmental and non-governmental policies and programs. In addition to the health sector, it is essential to involve the education, labor, justice, transport, environment, housing, and welfare sectors. Specific ways to promote mental health include early childhood interventions such as providing a stable environment that is sensitive to children's health and nutritional needs, with protection from threats, opportunities for early learning, and interaction that are responsive, emotionally supportive, and developmentally stimulating. Support to children, such as life skills programs, child and youth development programs. Socioeconomic empowerment of women, such as improving access to education and microcredit schemes. Social support for elderly population, such as befriending initiative, community, and day centers for the aged. Programs targeted at vulnerable people, including minorities, indigenous people, migrants, and people affected by conflict and disasters, such as psychosocial intervention after disasters. Mental health promotional activities in schools, such as programs involving supportive ecological changes in schools. The next is mental health intervention at work, such as stress prevention programs, and housing policies, such as housing improvement. Violence prevention programs, such as reducing availability of alcohol and access to arms. Community development programs, such as integrated rural development. Poverty reduction and social protection for the poor. And anti-discrimination laws and campaigns, promotion of the rights, opportunities, and care of individuals with mental disorders. Support to children, such as life skills programs, child and youth development programs. Socioeconomic empowerment of women, such as improving access to education and microcredit schemes. Social support for elderly population, such as befriending initiative, community, and day centers for the aged. Programs targeted at vulnerable people, including minorities, indigenous people, migrants, and people affected by conflict and disasters, such as psychosocial intervention after disasters. Mental health promotional activities in schools, such as programs involving supportive ecological changes in schools. The next is mental health intervention at work, such as stress prevention programs and housing policies, such as housing improvement. Violence prevention programs, such as reducing availability of alcohol and access to arms. Community development programs, such as integrated rural development. poverty reduction and social protection for the poor, and anti-discrimination laws and campaigns, promotion of the rights, opportunities, and care of individuals with mental disorders. Mental health care and treatment. In the context of national efforts to develop and implement mental health policy, it is vital to not only protect and promote the mental well-being of its citizens, but also address the needs of persons with defined mental disorders. Knowledge of what to do about escalating burden of mental disorders has improved substantially over the past decade. There is a growing body of evidence demonstrating both the efficacy and cost-effectiveness of key interventions for palliating mental disorders in countries at different levels of economic development. Examples of intervention that are cost-effective, visible, and affordable include treatment of depression with psychological treatment, and for moderate to severe cases, antidepressant medicines, treatment of psychosis with antipsychotic medicines, and psychosocial support, taxation of alcoholic beverages and restriction of their availability and marketing. A range of effective measures also exist for the prevention of suicide, prevention and treatment of mental disorders in children, prevention and treatment of dementia, and treatment of substance disorders. The Mental Health Gap Action Program, or GAP, has produced evidence-based guidance for non-specialists to enable them to better identify and manage a range of priority mental health conditions. Challenges of delivering mental health intervention in LMICs, lower middle-income countries. Despite the conceptual similarities and growing evidence for mental health promotion, prevention and treatment intervention may share conceptual similarities across the world, and have growing evidence, delivering this intervention in LMIC is bound with several challenges. The acceptability of intervention might also be different, especially as for distressed participants who do not present an established psychiatric diagnosis. Dealing with their psychological distress may not be a high priority as dealing with other social or health issues. Participants and their families with mental disorders, by contrast, may recognize that dealing with psychological problem is a high priority and prerequisite for optimal social functioning, thus showing more compliance and participation in psychological interventions. Many LMIC either lack or are poor in implementation of mental health policies, programs, and intervention, and have difficult access to mental health care. A key factor attributing to mental health issues in LMIC is the discrimination against people suffering from mental illness, where often they are labeled, exempted, and even abused. Additionally, the coordination and management of mental health intervention in humanitarian settings, including conflicts, disaster, epidemic, and pandemic, may present major challenges. For example, despite an increase in the incidence of mental health problems during armed conflict, earthquakes, epidemics, and famine in countries like Nepal, Haiti, and Ethiopia, the limited resources are diverted to areas other than mental health. There may also be many different socio-economic factors which influence the burden of mental health. In many LMICs, social factors such as poverty, gender, urbanization, internal migration, and lifestyle changes are moderators of the magnitude of mental health problems. Furthermore, low levels of knowledge regarding mental health problems have been suggested as an important factor that delays the intervention onset. Finally, the resources for delivery and training and the types of cadres of health workers involve increased heterogeneity across interventions, which become difficult to compare. Training, supervision, and competency assessment of those delivering this intervention have also traditionally not been prioritized in LMIC due to scarce human and financial resources. Though these have become increasingly addressed feature of LMIC trials and limited dissemination and implementation research capacity. My name is Wiki. I'm from Indonesia. Please join me in International Model United Nations. Thank you so much.